Okay, great. And what do you want to happen? Show me a little bit in the mirror when you look.
It just looked like, you know, like those two lines to like be a little softer.
Softened up.
Give me kind of like a sterner, what I want to say, like almost like a tired look.
Okay.
Like
yeah.
the last time I did it, it just like it makes your whole face look a lot fresher and
Right. Yeah.
friendlier, I guess.
It does, yeah, you're right. So yeah, when we put a little bit of filler, as we call them, in the nasolabial folds, it helps to soften up this line. So it's not going to completely make it go away because we want it to look very natural and subtle, but this line will look slightly a little bit softer and raised. And that's what we're going to achieve with doing a filler today. We could put a tiny bit of filler here and back here, not for the purposes of building a cheekbone for you because that could look feminine, but to lift this area up. Do you see what happens here when I do this? It lifts it up. So when we add a little bit of cheek filler, it kind of pulls everything up and lifts it up, because this nasolabial fold is caused by a couple of different things. One is that we lose volume within this area. We lose fat, elastin, collagen, but then also this skin kind of falls over and creates this little bit of line there. So doing both treatments, which is doing a little bit of filler in here and here, would be the best thing you can do. Now, we can start with the nasolabial fold since you've done that in the past, but just keep that in mind for future. If you want to see more of a difference, I think the cheeks would be a good place to go. The Juvederm Ultra Plus, I think it's a great choice to use in this area. We're going to do anywhere between 1 to 2 syringes, depending on, you know, how it looks as we're going about it. So let's start. So I'm just icing right now. The ice really helps to numb the area, and then it also helps to constrict vessels so that you don't get as much bleeding and swelling. Okay, a little polka. And breathing when we do any type of filler is really, really important. When people hold their breath, it causes them to bruise even a little bit more. So try to continue your breathing as we're doing little injections. And massaging. We'll experience a little bit of swelling the next couple of days, and then it'll settle in after about a week to 10 days. So that's when you'll see the full results. But it'll get more swollen than this. One more time. Relax. One more time. Okay. So I would do 20 here and 16 up here. So a total of 36 units altogether. Big smile. Have you ever done this? You've never done Botox, right? Big smile again. Take a look in the mirror. You see these little lines that show up? It would be nice to do a tiny bit. Yours aren't so strong here at all. So I would do 6 units per side. So that's 12 plus 36. So that's 48. Frown. Relax. And tilt you this way. Big smile. Relax. Bigger, bigger, bigger. There. And relax. One more time. Do that again. Interesting. And relax. You're done. Amazing. So now that we did your Botox, you have one more instructions. You shouldn't lay down for the next 3 to 4 hours, just so that they say it could possibly travel, so many different things, theories that we don't even know if they're true or not, but to be safe, just don't lay down for 3 hours.
I'm old, but I don't put a bed then.
One thing to know, Botox takes 7 to 10 days for it to take effect. Fillers, you see it right away, but Botox takes time. So this time next week, you'll see what it's supposed to do. In about 3-4 days, it'll start to slowly kick in. So sometimes it'll be very smooth in one area, or your brow will raise in one area more than the other. Don't worry, that's very normal. Once it all settles in, then it should be nice and smooth. I'd like to see you back in 2 weeks, since it's your first time doing Botox and because we just did your fillers, just so I could see how everything settled in. If it looks great, we leave it be. If we need a little touch up, we'll touch it up. Okay? All right, great. It's nice to meet you. You did amazing. Thank you. Good, good. So I saw you a couple of weeks ago, right? And we did your folds with filler, and did some Botox on your forehead and on around your eyes, right? Okay, great. How did that turn out? Tell me a little bit.
I feel it looks great.
Yeah?
I'm really happy with it at all.
Okay, good.
I don't think it looks like unnatural, or it just looks, I feel like my face looks very like smooth.
Okay,
And then also like this seriousness that kind of was happening here because of the folds
Yeah.
kind of like goes away.
Oh, good. Okay.
So no, I like it. I feel like it just looks like I went to a nice vacation.
That's exactly what we
Yeah.
want. We don't want it to
Yeah.
be very obvious, right?
Yeah.
We want it to be very natural looking. Let me take a look. Let me see you raise your eyebrows. Very good. Frown, like you're angry at me. Good. Big smile. Lovely. Frown one more time. Good. Now raise your eyebrows. Okay, so let me show you. I'm going to give you the mirror. And if you look, raise your eyebrows, you can see that you have a little bit of movement. So this is very natural. You want to have a little bit of movement here and there. I always ask people, because some people are wanting to have some movement, and some people are like, I want no lines, I want to be completely frozen. So how do you feel? What do you think about it?
I feel fine. I mean, I feel like compared to before, it's like such an improvement already, like in terms of like all the lines that were here, like clearly visible before.
Yeah.
So like I'm totally fine with having some movement.
Yeah, so it looks a little natural, right?
Because like otherwise, like then my face is gonna start looking dead.
Yeah,
like
you're talking to me expression.
And like all of this is moving, and then here it's just like.
Exactly. Okay, I'm glad we're on the same page. So what I want to do is just kind of feel out where we did the filler for you. Just make sure it's soft. And one side was a little bit deeper. It was this side, right? We did a little more. Everyone has that. One side is a little different than the other. And then we were talking about potentially adding a little filler to the cheeks, but I wanted everything to settle down and see how you feel about it, and then go from there.
Yeah.
What are your thoughts now?
The cheeks?
Yeah.
No, I want to do the cheeks.
Okay, because then it'll be too much for you. I think this looks really good.
I think, it's like totally what I wanted. Like, I feel like I look the same, but just
softer.
Refreshed. Yeah, softer, a little more.
Beautiful.
Yeah.
Okay, good. Any questions you have for me with this or regarding any other?
So the Botox is going to last 4 to 6 months?
Usually about 3 to 4 is what we say.
Okay.
Yeah. On average it's about 3 or 4, but the filler would last anywhere between 6 to 9 months. That's usually the case.
Cool.
Yeah. I tell people not to wait the full 9 months to a year to come back for filler, just because you want to build up on what you've done in the past. So let's say we layered the foundation for you this past time when we did the filler, and you want to kind of add to that each time. So if you come back like around 6 months, 7 months, that would be the best time to redo it. So we're adding up little by little, and each time you do it, it tends to last you longer and longer. Okay? All right, very good. Thank you for coming by. Here, I can take that for you. Hi everyone, I'm Melody with SkinTight Aesthetics. This was our YouTube video of nasolabial injection and Botox injection, and I just wanted to thank you for tuning in. Please like and subscribe. Thank you.